Over the past few years, the emergency departments have seen a substantial increase in the volume of patients coming to receive emergency care. In order to help meet that increase in demand, that provider meets with the patient very early, right after their check-in with the triage nurse. And once that provider does that initial assessment, they're able to put in some orders to help us start the plane of care, that patient's care progression through the department. The unfortunate piece is that for most of our patients, they don't understand how much care is being provided to them while they're waiting for a treatment space to open up. So they may go from the waiting room into a triage room and get a blood draw and it goes back to the lab, but then they return to the waiting room. They may go back to a radiology room, get a scan, and be brought back to the waiting room. So we identified this gap of awareness as a real opportunity for this navigator role, someone who could not only have clinical eyes on the patient and families as they're in the waiting room, to spot some of those most important symptoms that we watch for, the most dangerous pieces, but that person is going to be best equipped to explain in detail with specificity how much care is being provided behind the scenes. Then throughout their journey, the nurse navigator is reconnecting with those patients and families to provide meaningful updates as we progress through the care plan, even if it's still taking place while they're in the waiting room, especially if they're in the waiting room, and then also circling back on those unique needs that have been identified. We want to show them how much we value their time and their trust. We're looking for those very special candidates who have the nursing background, the emergency experience background, to know the flow of the department and speak to it intuitively, while at the same time having that very unique compassion communication gift that will help them connect with those families in a meaningful way.